name is Nathan, and I'm going to be your student nurse for the day. Filming, and could you tell me your name and date of birth?
Noah Van Gilder, September 20th, 2000.
Okay. And I'm just confirming on the wristband. And do you have any allergies, Noah?
No.
Okay, so I'm going to be doing a cardiovascular assessment on you today. That's going to consist of me listening to your heart sounds. I'm going to be palpating your chest, okay, making sure I don't feel any abnormalities. I'm also going to be checking your pulses on your neck, okay? Okay. Is it okay if I begin?
Yeah.
Okay. Just scanning the patient. I have an age-appropriate male sitting upright, no signs of distress, pallor. Skin is intact and well perfused. No signs of anxiety. Breathing is spontaneous. No signs of tachypnea. No obvious signs of JVD as I look at the neck. And then I'm just scanning down at those feet, and I'm making sure I don't see any signs of peripheral edema, and I do not. Okay. So I'm just going to begin with a couple questions for you, Noah. Have you had any history of heart failure?
No.
Okay. Heart attack?
No.
Okay. Do you take any antihypertensive medications?
No.
Have you been diagnosed with an arrhythmia or dysrhythmia?
I have not.
Have you ever smoked tobacco?
No.
Okay. And do you have any chest pain when you exercise?
No.
How about shortness of breath?
No.
Okay. So now I'm going to begin with my chest examination. I'm just going to pull this down. I'm looking at chest expansion, making sure it is consistent and even. I'm palpating the chest for any kinds of muscle deformation or crepitus. I'm also inspecting the chest and making sure I don't see any signs of implants, and I do not. Again, I'm looking at the neck, checking for any carotid pulsations, no lifts or heaves of the chest, and also no JVD, as I said earlier. Breathing appears spontaneous and unlabored. Okay, so now I'm going to palpate those carotid arteries. Okay, and then on the other side. Okay. And the carotids are 2+ bilaterally clear and consistent. I'm going to auscultate with the bell. Okay. And I hear no signs of bruit when I auscultate. I do hear a little bit of the heart, but that's as expected. Okay, now I'm going to palpate for the apical pulse. So we're going second intercostal, we're going third, fourth, down to the fifth. Okay, and that apical pulse is palpable. All right, now I'm going to begin listening to your heart sounds, okay?
Okay.
Beginning in that second intercostal space, and we're listening to the aortic valve. And S2 is louder than S1. I hear no signs of S3 or S4 gallops, no signs of valvular regurgitation. And now we're going to the second pulmonic valve. Again, S2 is going to be louder than S1, and I hear no signs of S2 or S3 gallops or valvular regurgitation. We're going to Erb's point, which is in the third intercostal space. Okay, S1 and S2 are equal. Now we're going into the fourth intercostal space, and we're going to be listening to that tricuspid valve. Okay, and we have S1 is louder than S2 here. And now finally we're going into that fifth intercostal space. And we're listening to that mitral valve where S1 is going to be louder than S2. No signs of valvular regurgitation, and again, no signs of S3 or S4 gallops. We're going to go over one more time with the bell of the stethoscope. Okay, so again, second intercostal. Third intercostal, Erb's point. Fourth intercostal. Tricuspid valve, and then lastly that fifth intercostal. That mitral valve. Okay. All right, Noah, so that's going to be the end of our cardiovascular assessment. Just so you know, I didn't find any abnormal findings, nothing that was unexpected. Do you have any questions for me?
No.
Okay. I'm phoning out.